Good day, everyone. I'm Melissa, a Lebanese medical student, and I'm also pursuing a master's degree in research. I'm currently the Director of Research, Education and Outreach at Oli Health Magazine Organization, OHMO. But what is OHMO? So very briefly, OHMO is an international NGO. It's a sort of an international research academy whose aim is to focus on education and give access to many educational activities to everyone, medical and non-medical peeps, and also to provide research opportunities. In addition to that, we work on many projects as the Coronavirus Global Awareness Project. We get into many partnerships, for example, our partnership with the Harvard medical students. And our work gets featured on Forbes magazine, United Nations, and the Royal Society of Tropical Medicine and Hygiene in London, and so many other regional and international magazines, TV channels, and so on. Okay, so when students think about research, the first things that come to their minds are maybe tubes and pipettes. But when I think about research, I picture it as the key to a successful medical career. So becoming a successful doctor begins the moment you jump into medical school. From here, you have to think outside the box, think outside the references, the PowerPoints. You have to do the undoable, think the unthinkable, and achieve the unachievable. Therefore, you have to reset your priorities, refix your vision, and research for the right opportunities. And while researching for the right opportunities, you'll discover that research is definitely the key to a successful medical career. It is known that the materials learned in medical school all come from research, of course. Research helps develop critical reasoning skills. The student will be trained in challenging the status quo and in synthesizing information rather than regurgitating it. And she will learn how to be consistent and systematic in how they approach problems. So these are the skills that each will need in medical school and beyond. Research experience in med school is increasingly becoming an important factor when it comes to obtaining training positions postgraduate. So competitions for such training positions are very fierce, and having research experience is a distinct advantage. In fact, at the majority of the most competitive research-oriented medical schools, around 80 to 90% of admitted applicants have at least some research experience. On the other hand, interesting scientific papers and research can be published in scientific journals, and this will help in boosting CVs. As future physicians, students will need to continue learning throughout their career. Let us not forget that medicine is a perpetual journey. Also, physicians need to be able to think like scientists, and having familiarity with conducting research will help them to judge how credible a given study is. Furthermore, clinical research is what allows doctors to decide how to best treat patients. It is what makes the development of new medicines, new procedures, new tools possible. Without clinical research, doctors would not be able to decide if new treatments are better than the current ones, and it is how doctors find the most effective methods of care for their patients. Last but not least, the flare-up of COVID-19 has shed the light on how crucial research is in the time of a pandemic, whether during the outbreak preparedness or the response via shaping policies and communicating the guidelines to the worldwide public, or even during the establishment of vaccines. Rule number 1, you have to start somewhere. After all, no one has it all figured out since the very beginning. So here are the basic steps that you must follow. You have to find your passion, your interests. Then you pick a relevant topic. You start doing some search, find the information. You set the plan. You talk to a supervisor. You secure your tutor. Of course, she has to be someone you can rely on, someone you really trust. You might prefer working with a team so the work can run smoothly. why not? It's also an option. After this, you have to locate the materials, the methods. You start writing your article. Don't forget you have to mention the references at the end. One golden rule, you have to obey the policies set by the journal so that your paper, your article becomes eligible. Final step, you have to proofread it. You get the confirmation from your supervisor, you submit it to the journal, and then through the whole process, you have to remain patient and perseverant. It's a long and tiring process, yes, but at the end, it's worth it. And remember, it's not an overnight process. Last but not least, it's true that we medical students are overwhelmed with our studies, but I think we should definitely burden ourselves with doing some research and not miss this career boosting opportunity. After all, we should remember that research active physicians are the ones who provide better care to their patients. And here's a small challenge to the people who are still watching this video till the last second. Somewhere, something incredible is waiting to be known. So dare to be the one who reveals these hidden gems. Thank you.